Assalamu alaikum, good morning. This is a pre-course lecture for Advanced Endoscopic Skullbase that's going to take place on February 1st and 2nd at the King Khalid University Hospital. This lecture we're going to discuss the anatomical basis of the skull base. The skull can be divided to facial bone and cranium bone. Cranium bone can be divided to calvaria and the base. The calvaria is made up of 5 bones: frontal bone, uh, parietal bone, sphenoid bone, squamous part of the temporal bone, and squamous part of the occipital bone. And then you have the base, and the base of the skull, of course, it has two faces, endocrine and exocrine faces. The endocrine, of course, facing the brainstem, and the exocrine facing 5 basic region, the nasal cavity that include nasopharynx and oropharynx, the orbit bilaterally, subtemporal and parapharyngeal space, and finally the craniocervical junction in the back. Looking at the endocrine part of the skull base, it can be divided to 3 foci. The anterior and the middle foci divided by the sphenoid ridge, and the middle and the posterior foci divided by the petrous ridge. The endocrine component also made up of 5 bones: the frontal bone, sphenoid bone, ethmoid bone, temporal bone, and occipital bone. Now we'll talk about these bone individually. The frontal bone also made of 5 parts: the squamous that include the eminence, the orbital plate, and next is the fossa ethmoidalis, which is not seen here. I'll show it later. Supraorbital ridge or superciliary arches, which is bordering the upper part of the orbital ridge, and finally zygomatic process of the frontal bone. Here you can see the fossa ethmoidalis, part of the anterior fossa. The medial part just articulate with the ethmoid bone or cribriform plates in the ethmoid bone, and it's the roof of the ethmoid cells in the paranasal anatomy. That will show details here. The orbital plate, as you can see, covering the orbit, and then you have the cribriform plate from the ethmoid bone. In between, you can appreciate a piece of bone that covering the ethmoid cells, medial to the orbital medial wall, and that is the fossa ethmoidalis. We're going to show it here again. This is important for transnasal, that's why I show it multiple times. This is the orbital plate, fossa ethmoidalis. Now you can see also we added the planum sophonoidali, medial, posterior, and anterior fossa. And you can see the cribriform plate with the crista gallia. Here also you can appreciate the olfactory tract and bulbs bilaterally. If we remove the orbital plate, you have an access to the orbit, and if you remove the fossa ethmoidalis, you will have an access to the ethmoid cells. And just extra bone to be removed, which is the planum sophonoidali, that will give you access to the ethmoid cells as well as sphenoid sinus, as you can see and appreciate in this image. Now the middle fossa is, ethmoid bone is made also 5 parts, as you can see here. We'll start with that important bone that we usually deal with it in endonasal endoscopic approaches, the lamina papyracea, which make an important part of the medial wall of the orbit, as you can see, and conchi or turbinates. The middle and the superior turbinate is part of the ethmoid bone, the inferior turbinate is not. The lateral mass or labyrinth of the ethmoid bone you can appreciate here, which make the ethmoid air cells, and the cribriform plate or the horizontal plate, which made of cribriform plate and cristagallia. And finally, the peripendicular plate, which make an important part of the septum of the nose, of course. The sphenoid bone also made of five parts: the body, and greater wings with the part that is flat and facing the lateral face of the skull, as you can see here, and it make an important contribution to the middle fossa, as well as the lateral and the posterior wall of the orbit, as you can appreciate in this image. The lesser wing, which with the greater wing and the lesser wing will both make the superior orbital fissure, and you can appreciate also here the optic nerve, optic canal is within the lesser wing. And now we'll have a look to the fourth component or fourth part of the sphenoid bone, which is a pterygoid, which has two plates and the base. And as you can see here, these are the pterygoid plate. It has the Phedian canal, which is an important landmark in transnasal approach to the lacerum segment of the internal carotid artery. And finally, the concha of the sphenoid, which is making the face of the sphenoid sinus. The middle fossa is made of two bones, the sphenoid bone and temporal bone. Temporal bone is made of five parts as well. The first part is squamous, which is going to make the lateral cover with the parietal bone as well as sphenoid bone and of the skull. And petrous bone that include the mastoid, petromastoid part or segment of the temporal bone. Tympanic, which make the exohereditary meatus. Styloid process that is important to localize the facial nerve as well as the intercranial internal carotid artery before it enters the cranium, and the zygomatic process of the temporal bone as well. There is important area that connect the two middle fossae, which is the cella and the paracellar. We'll have a specific lecture on that region, as it's extremely important for the transnasal approaches. But it's for now, it's made of anterior conoid, posterior conoid, sella thoracica, tuberculum, and dorsum cella. And this is a details anatomy of it. As I said, we'll talk about it later in details. There is four phenomena that is important: rotundum, superior orbital fissure, we talked about already, lacerum, ophalia, and spinosum. Ophal is made of, or there's five components of ophal. From an ophali is stand for otic ganglia, Phi3, accessory and meningeal artery, lesser petrosal nerve, and emissary vein. And finally, the posterior fossa is made of temporal bone and the occipital bone. We talked about the temporal bone. The occipital bone is made of five components as well. It contributes to the clyphus and form an important foramen, which is the foramen magnum, as you can see here, and it has occipital condyle. It has squamous part, of course, the third part, base and opositoron, which is the foramen magnum boundaries. I think I'm going to conclude this presentation. Thank you very much, and we'll talk about more and further details later about specific structure that related to the expanded endonasal approaches that will serve for the course. Thank you.